Primary mandibular deficiency growth patterns with or without maxillary arch constriction. Mandibular Anteroposterior Defciency Introduction 1909 P. Blair, 2 cases of retrognathia in which a horizontal ramus osteotomy was performed on each side of the mandible. Mandibular deficiency is the most prevalent form of dentofacial deformity. More common among Caucasians than Africans or Asians. Hereditary component is a predominant part of the etiology. Severe mandibular deficiency, deepened as 7 mm of positive overjet, angle class 2 malocclusion during growth. If the lower lip stays behind the upper teeth, then the upper teeth will adapt by tipping forward, thus creating a class 2, division 1 malocclusion. If the lower lip remains in front of the maxillary incisors, there is an adaptive tendency for the maxillary incisors to tip lingually, i.e. class 2, division 2. Functional aspects: articulation errors during speech and swallowing difficulties, due to class 2 malocclusion, difficulties with chewing and with lateral and protrusive mandibular movements, due to class 2 malocclusion, upper airway obstruction during sleep often exists as a result of the retropositioned tongue. Obstructive sleep apnea should be ruled out. Detrimental long-term effects on the dentition and the periodontium, due to crowding. A higher incidence of temporomandibular disorders, result from mandibular deficiency class 2 malocclusion. Clinical characteristics: the lower lip is curled and everted, and it is often wedged behind the incisors with an accentuated labiomental fold. The shorter the lower anterior facial height, the greater the tendency for an accentuated labiomental fold. The gonial angles of the mandible tend to be relatively square. The shorter the face and the deeper the bite, the more acute the angles. A retruded and weak chin with a convex profile. A deficient mandible with the illusion of a large nose. A short chin to neck length and an obtuse angle, often with a double chin, even in a thin individual. The upper lip appears short, curled, and protrusive.